All right, joining me now is the Director of Infectious Disease Research, Dr. Matthew Sims from Corwell Health East. Thank you so much for joining us tonight. And
Happy to be here.
Everybody wants to know, as we discuss this conversation, that this topic is the pandemic over, and can we let our guard down?
So that's not a simple question to answer. So the emergency's certainly over, but the pandemic's not over.
So
COVID's
what's
not
the
gone.
difference? What's the difference?
Well, 3 years ago when this all started, nobody had any immunity. It was a brand new virus. It hit everybody hard. It hit sicker people harder, but even young, healthy people were dying from this virus that humans had never seen before. Now, 3 years later, a large part of the population's vaccinated, a large part of the population has had COVID, and now they have antibodies. So generally speaking, people who get COVID now don't get as sick. The virus itself has changed. Now we're on Omicron and all of Omicron's subvariants.
Sure, and they seem less mild, the symptoms when people come down with it, generally speaking.
Are milder than it was under, the original or Alpha or Delta.
Yeah, and so going forward, do you envision that it's going to keep getting vaccines and boosters like we do with the flu shot?
Yeah, so, it's an interesting question. Right now, the current thinking is that they're going to have it as a once-a-year booster around the time you get your flu shot. Nobody's sure yet. But, the difference here, though, is, flu is a seasonal virus. It's at one time of the year. COVID's all around, around all the time. But getting a booster once a year may still be better for most people than trying to say, well, give it again now and give it again now. It makes it simpler. It makes it something people are used to. So overall, we may get more people, to actually stay vaccinated. And it's important for people who, have weaker immune systems, have underlying problems where the COVID's going to hit them harder, lung problems, and older people.
As you see crowds gather at restaurants and sporting events and concerts and comedy shows, do you say, okay, we're back to normal? Do you shake your head? Do you say, hey, we should still be wearing masks? What is your viewpoint on this here?
You probably saw when I was, coming in, I'm wearing a mask, right? So when I'm in public, when I'm in a crowd, certainly, I wear a mask.
And do you recommend that still for people that,
it's
because we're not seeing masks that much anymore.
We're not, but certain people, yes. I haven't had COVID yet. I don't want to get COVID.
Neither have I.
don't want to take the risk of getting long COVID, right? So when I go out into a restaurant, or I usually go off hours so it's not crowded. When I go to the supermarket, I wear a mask. Here you and I, I'm taking the chance that, you don't have COVID and you're not going to give me COVID. Small groups, I'll take my mask down. People I know, I'll take my mask down. I wouldn't do that a year and a half ago.
Sure, and there was a recent report that the CDC was at a convention and some of them came down with COVID and they weren't wearing masks. And so I think it leads to some confusion where we see this ending and the public emergency ending, yet we go, okay, well, it's still here. How serious do we need to take this?
Yeah, so again, for most people at this point, it's going to be a mild infection. If you've had it before, you've got antibodies, it's probably going to be a mild infection. If you're vaccinated, it's probably going to be a mild infection. If you've never had it, if you're not vaccinated, if you're older, if you've got underlying lung problems, if your immune system's not working right, because you're on medications that knock your immune system down, you have a transplant or any of these things, those are the people who really have to think hard about wearing masks when they're in a risky situation.
This has been going on, obviously, a little more than 3 years. Yep. Did this take longer than it should have? Should this have ended way earlier?
No, I don't think so. Until recently, we were still getting a good number of patients in the hospital every day. We still have patients in the hospital with COVID every day, pretty much. But the numbers have come down. We were hovering for quite a while, at 100 or so across the system. And, you don't see that many flu, usually, even in flu season. So it's telling you something. Now, a lot of them, it was because they have other issues besides COVID. So, the average 18-year-old, they're probably not going to get that sick at this point.
Sure.
Go back, they got sick, I mean, one of the first patients I remember having who died was 35.
Wow. It's hard to imagine, and so now it feels like we're on the other side of this. Obviously, COVID still exists, despite the public emergency ending tonight at midnight. We're on the other side of this. What do you say to people that go, you know what, this took way too long, it was overblown, it wasn't as bad as people thought, and we got a lot of bad information?
You know, I think there was a lot of bad information out there, but I think it was mostly going the other way about how vaccines were dangerous and how it's not that bad. You know, I think people have forgotten or just didn't see the horrors of COVID, right?
You were in the hospital.
I remember what the hospital was like. It was war. You know, it was, you know, people were not coming to the hospital if they didn't have to, and our floors were loaded with nothing but COVID patients. You know, we were converting floor after floor after floor to COVID wards. You know, it was just not, you know, and I mean, nursing homes were getting wiped out.
Right.
You know, the mortality among patients in nursing homes was sky high.
Can I ask you one final question?
Sure.
What did we learn from the pandemic, and are we better equipped to handle, you know, God forbid, something like this again?
You know, that's a great question, because, you know, one of the things we learned is that it was a bit divisive. Like you said, some people say it was overblown, other people say it was underrepresented. I think we know the things we have to do, and I think, you know, people may not like them. There are people who speak against them, but the mRNA vaccines were so effective, way better than we could have ever expected. And so we have, you know, tools. We know we can make a new vaccine quickly that's hopefully going to be as effective for the next thing. But, you know, we just don't know what the next thing coming is. And so hopefully we've learned the lessons that, you know, pandemics are very dangerous. And, you know, we will, you know, if the next one comes, we'll act quickly and decisively to save people's lives.
Well, Dr. Matthew Sims, thank you so much for joining us tonight and for the insight as the COVID-19 public health emergency comes to an end at midnight. We'll have more after the break, including Ahmed Badji's back with your forecast, plus another look at the top stories across the country.